So as the state gets closer to having to pay part of the Medicaid expansion, the issue of the health exchange set up through the Affordable Care Act is becoming a bigger and bigger issue. You've said that you think that it's possible we could pay the 5%, but maybe not the 10%.
Right.
But you're against repeal at this time.
Right.
If we can't pay the 10% down the road, what do we do?
Yeah, so we should know in advance whether or not we can't pay it. And the reason why that matters, and the reason why I'm sort of against repeal, now if we couldn't pay the 5, we'd probably have to be scrambling, but it looks like we've got it. But the 10 though, the problem with that is that if you can't afford the program, you can't have the program, and that's just kind of how it works. So the idea was, the reason why I would be reluctant to cancel it to 5, even if long term we're still out, is because jumping from a large, unwieldy, software-driven system to a completely different one is not a costless transaction. It's actually extremely expensive and disruptive, and we just did that. And the reason we need to give the healthcare workers a break for a little bit, like buy them some time, and also then, if we realize, okay, we're going to miss. So, like, here's a hypothetical outcome. Let's say I've totally called this correctly. We hit a recession in 2018, and we stay in a recession in 2019. 2020, now we owe 10%. Probably are not going to be able to pay that, but we're going to know in 2018, 2 years in advance. And in the meantime, there are other states that are experimenting with other versions of this. And so my recommendation is, let's just hang out and wait, and let's see what they come up with. Libertarians are telling me things that Texas is about to do are going to be great. I'm like, as soon as they start doing them, we'll have a look at that, because I'm not opposed to it. If somebody actually does develop a better system, then absolutely we'll jump to it. But we need to wait right now because it's going to be too disruptive.
So do you think that Kynect has been working up to this point? I mean, obviously a lot of people's main complaint is that the majority of people are on Medicaid. They're not getting actual health insurance. So do you think that it's working?
For the solution it was supposed to solve, yes, which was let's get people who are not insured. They were not trying to, let's get everybody's premiums down, which clearly didn't happen. I mean, even mine went up. But so it did solve the problem it was supposed to address. Other new ones were created. And so you have to sort of evaluate it based on that. And then the question is, okay, now that the other ones were created, did we get a better deal out of this or not? And in particular, one of the questions was, would this thing be able to fund itself? Would the increase in healthcare spending account for a 5% hit in 2016? And it looks like yes. There was a report that was released a couple weeks ago, says we're more or less on track to hit that. Okay, good. But going forward, if any of these things should change, it's projected that it'll be okay, but projections are great, but I don't get excited until the check clears, so I'm going to be keeping an eye on it, basically, is the thing. And if we can't afford it, we have to do something else. But ideally, make the call as early as possible and be as the least disruptive you can possibly be.